Hello friends, in this video we'll talk about pericardium. Okay, so let us see two important pericardium, that is parietal and serous. So if you know how to write pericardium as in parietal and serous, the plural also will be very easy. Okay, I'll tell you the comparison. Okay, right, right. So first of all, yeah. Yeah, so coming to the parietal and serous pericardium, here we can see the differences in the table. So parietal pericardium is adherent to the fibrous pericardium. Here it is the myocardium. Myo is muscle, cardium means heart. So heart muscle. Heart is supplied by coronary artery. So coronary artery will be coming here. And for the parietal, it will be supplied by the internal thoracic artery. And derivative, this is somatopleuric, splanchnopluric. Here somato, splanchno. Okay. Nerve supplies the somatic and autonomic nerve fibers. Here somatic, here autonomic. And which is pain sensitive? Parietal. Remember, PAI, pain. Okay. Right. Here we can see the two sinuses, the transverse, and this is the oblique sinus. Okay. And the blood supply, as I already told, it is supplied fibrous part, internal thoracic, and you can also, yeah, just internal thoracic would be enough. And the visceral part, as I said, coronary artery. So how to remember and tell? You know that the visceral layer is the, yeah, we have said visceral layer is the myocardium, and heart is supplied by coronary artery. So that is why coronary artery. Then the nerve supply already told. Now surgical significance of transverse pericardial sinus. So basically what we do is we take the fingers like this and put it through the transverse sinus. So this is how the finger is inserted. Okay. And also there is a ligation, heart tube machine is there, will pass all through that. And most important thing here is the pericarditis and cardiac tamponade. So pericarditis is the inflammation of the pericardium. Anytime itis, it is an inflammation. And here fluid accumulates, pericardial fluid, that is why pericardial effusion. It is just like pleural effusion where you have pleural fluid. Here you have serous fluid. Okay. Yes. And also the systole, diastole, that is also affected, that is cardiac tamponade. Okay. And it is also seen in uremia, where the urine is more in the blood urea. Okay. Then these are all the pericardiocentesis, pericardial friction. Okay. So briefly I'll just explain. Pericardiocentesis is nothing but the increased pericardial fluid because of sternal approach and subxiphoid approach. Sternal approach, that means towards the sternum. Where in the sternum? We'll insert it at the 5th or 6th intercostal space. Okay. Yeah, mostly we take 6th intercostal space. And subxiphoid. So within the xiphoid process. So the needle is at the costoxiphoid angle. What does this mean? Between the costal process, the costal cartilage, and the xiphoid process. Just remember, at an angle of 45, at the costoxiphoid angle, we are inserting the needle, that is subxiphoid. Sternal, that is into the sternum. Where in the sternum? 5th or the 6th intercostal space. And sometimes even friction also develops. Just like we have seen for the lung surfactant also, there is some friction that is developing because there is a roughening of the serous pericardium due to inflammation. So that creates the friction rub. That brings us to the end of the video. So thank you so much. I'll see you in the next video.